First up, in terms of the COVID measures being taken in the country as development of vaccines in India reach final stages. Centre has said that a 2-day dry run exercise will be held in 4 states, which includes Andhra Pradesh, Assam, Gujarat and Assam, to carry out an end-to-end testing of the COVID-19 vaccination process. Each state will identify 1 or 2 districts for this to conduct the dry run. The key parameters of the program will include mock drills, review meets and planning the procedures as per internationally prescribed guidelines. I'm joined by my colleague Gauri, who's taking us through some of the main objectives and steps which will be followed in this 2-day dry run, which is being done in preparation of the time when actually a vaccine is cleared in the country.
That's right, Tanima. So the thing is that these vaccine dry run has very specific objectives in mind, and several states, as you rightly mentioned, that are preparing to conduct these dry run. Let me take you through some of the purpose and the objectives of this particular vaccine dry run that will be conducted in several of the states. First is, of course, to assess operational feasibility of whenever this vaccination rollout actually takes place. And another important thing is that the test planning and implementation mechanisms, how are they, whether they are adequate or not, whether they are in place or not, all these things will be checked during this dry run. And also during this dry run, the objective would be to identify challenges that is related to vaccination and the entire process, which is very complicated and huge and also very, very risky. So all these things will be evaluated during that dry run, and also it is going to guide the way forward for prior to implementation. So this is also one very important thing, because remember, the centre has asked states to prepare this entire vaccination rollout plan, and any day now that we can get a clearance for a vaccine, and that is why states are conducting these dry run. And also it is going to provide confidence to the program managers and everybody involved in the vaccination rollout process. So these are some of the objectives of the vaccine dry run that would be conducted by several of the states. In fact, let me give you more information on this and what exactly is vaccine dry run going to include. One important thing is that it will include planning and preparations for vaccine, and of course the entire mechanism which is in place, whether it is adequate or not, all these things will be kept in mind while conducting this dry run. And also the data of healthcare workers will be uploaded. Remember, centre has asked states to actually create a database of all those health workers which actually can take part in this vaccination drive, and also deployment of team members will also be included in this particular dry run. And also it is very important for states to actually evaluate how much human resource do they have, how much of them are trained, and how many of them actually need training. So that is also important thing. And session planning and vaccinator deployment will also be included in this particular dry run. And also there will be a review meet at block, districts and state level, so that the entire vaccination rollout, whenever it takes place, is actually smooth. And also it is going to provide feedback to guide future actions. That is also a very important thing. And these are some of the broad points that will be included in this vaccine dry run. And also mapping and session site creation will also be included in this particular drive. So these are some of the main objectives, and also what are the things that will be included in this particular vaccine dry run.
Right, there's no vaccine in place yet, but the centre still taking all steps to ensure that they are prepared for once a green signal is given for vaccine use. Gauri, thank you so much for joining us with that explainer on what will be this 2-day vaccine drive in these 4 states. Shifting our focus on to what's happening internationally in terms of the new strain which has been discovered in South Africa. Now, remember, South African COVID strain is supposed to be one of the most virulent strains, or the new strains among the 2 new strains which have been discovered. Remember that UK had also reported one local strain which had mutated, and that was already supposed to be 70 times more infectious, and the South African strain is supposed to be even more so. Now, the government in South Africa has announced an alarming rate of spread of the new strain of coronavirus, with more than 14,000 new cases confirmed just in one day yesterday. This also includes more than 400 deaths which have been reported in the country due to COVID. Calling the virus unrelenting, the country's health minister has said it's the largest single-day increase in cases. The new variant in South Africa is now the most predominant one in the country as confirmed infections approached 1 million.